We're gonna go over today is another kind of low back pain topic because I see this a lot in the clinic. I see this a lot in the gym when people perform things that require a lot of hip extension, and they always say, oh, I always feel it in my lower back. So an example of that is running, they feel it in their low back, deadlifting, they feel it in their low back, even some like squats, they feel it in their low back, lunges, basically anything to do with your lower body tends to require quite a bit of hip extension. And if you don't have, one, the mobility to do hip extension, things are gonna F up. And two, if you don't have adequate active control of hip extension, things are not going to work the way they should. So I wanted to cover this whole topic because it's something I always talk about almost on a daily basis when I see a patient in the clinic dealing with low back pain. And it kind of goes down to that whole concept and idea that glute function, your glutes don't fire, glute amnesia, or whatever you want to like call it. So we're gonna kind of unravel that whole topic in today's episode. So for those who don't know, hip extension is when your leg goes back to extend the hip this way. So I'm gonna get Angel to extend her right hip into extension. And good. So that's hip extension. Not really that exciting, that, intricate, but so vital with any kind of exercise dealing with deadlifts, hip thrusts, squats, all those things. So number one, there is like a sequence of firing when it comes to hip extension. Number one, it should be the glute that engages. Then number two is your hamstring, and then lumbar spine. What we see a lot is that people end up going lumbar spine first, then hamstring, then glute kind of just is there. Or you'll hear people saying, my hamstring cramps when I do glute bridges, I feel it in my low back and nothing in my glutes. So those are like the two scenarios that we always see. A lot of times too, when I assess somebody, when we do exactly what Angel just did, a demonstration of hip extension, I'll always ask them, where do you feel it? And they're like, pretty stiff in my low back, extend. And then back down. What did you feel?
It did feel low back a little bit.
So even when I assess hip extension, I'll kind of watch what happens. And like right away, Angel likes to use this portion of her back. So if you go again, you can even and go again.
Do it now?
Yeah. You can already see like this hip will drop down and then this starts firing up. So there's a couple things that we can do. Number one, we have to figure out if it's a mobility issue, so we can check passively. We can do other orthopedic tests. What do you test for hip extension?
You can do Yeoman, where you can bring it up like this.
Yeah.
Like passively.
Yeah.
And then any of the internal external rotation doing that way as well.
What about the one on the table where you have the leg off to the side?
You can do Gainsland's or Thomas.
Can you say those tests out loud for the audience?
You have Gainsland's. Oh, I always get these two mixed up. I believe Gainsland's is the one where that's off the table, whereas Thomas is fully on the table. Thomas is like this, I believe, and the examiner is the one that's putting overpressure, whereas Gainsland's is off the table and you as the patient is the one doing the pressure and the other leg is falling off the table.
Yeah, so for those who don't know, those are like orthopedic tests that most physiotherapists, chiropractors, or future naturopathic doctors will learn to rule out or figure out any kind of musculoskeletal stuff. Do I use them? Sometimes, but again, there's so many different ways to skin a cat, and it's all based on how you're trying to figure out what.
How would you use that expression?
What, to skin a cat? That's a pretty common phrase that people say. No?
I don't like it.
You don't like it? There's lots of ways of figuring this out. Okay, hip extension. I use the FRA. I test passively and actively, but I care mostly about active control because that's where it translates more into everyday stuff and more into what happens at the gym. So when I see that this is not working, well, hip extension is not working and this is overpowering, we need to figure out how to, well, number one, activate the glutes. There's so many ways of doing that, and there's ways to kind of prevent lumbar extension from happening. So we're gonna go down the rabbit hole of probably demonstrating some exercise before I go back into more hip extension stuff. So something that I like to use in my kin stretch classes and things like that is, number one, priming the kind of nervous system to one, because a lot of times where if something doesn't move the way it should, I kind of automatically think of your nervous system is the gatekeeper to everything. And if I constantly have someone putting an emergency brake on for every single body part that I have, I'm not going to have a really good chance of activating what I want. So sometimes what we'll do, at least in my programming, I will incorporate things from the kin stretch practice that I have, like PAILs and rails, to directly communicate to the nervous system to be like, hey, I want to utilize this movement pattern. Here are the muscles involved in the pattern, and I'm going to tell my nervous system that I need more kind of recruitment for those muscles to ensure that I don't hurt my lower back when I deadlift. I'm going to get you into a half kneel position. Up I am. And we're going to kind of, oh, these shorts are really tight. We're going to go into kind of almost like a runner's stretch like this, but move the knee further back. Do you feel a stretch in here?
Mm-hmm.
So essentially now we're stretching hip extension muscles that are responsible for that. How we're going to do a PAILs and rails contraction is we're going to slowly lift this up. You feel the knees now flat on the ground?
Yeah.
So you're going to hold that there. When I tell you to go, you're going to drive your knee down to the ground and that way.
And this way?
Yeah, almost like you're trying to like knee someone forward. And go. Start pushing, push, 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 push. We're going to hold this for about 10 seconds. And relax. And now kind of sink deeper into it. Because right away, like even all the people on watching, like the moment she stopped, her whole hip already dropped forward. Because now we told her nervous system, like, hey, let's have more hip extension. And then you did that little isometric contraction, and it was like, okay, I'll give you a little bit more. So let's go back to that same position. And now we're going to do the rails in this. There is a chance, babe, that your hamstring might cramp. Because what we're going to do is the opposite. We pushed forward in that way. Now you're going to think of driving your heel up towards the ceiling. But when you do that, when I tell you to go, think of squeezing your glute, driving the heel up. And up. Drive it up, drive it up. Again, 10 seconds. Go, 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 go. And relax. And you can put this down. How did that feel?
Fine.
Okay, so now let's go back to that prone position, because now it's like test and retest. That's what we always do to see if things are working. Go back to that prone position and show me hip extension like we did before. So right away what I noticed, and relax, this was quiet, the glute fired, and then the hamstring. Did that feel different?
Yeah.
Yeah, so like huge difference, and like, oh my god, it's like magic, it's like voodoo. Not really. It's just manipulating our nervous system for our advantage. So imagine now if you were doing your warm-up and we literally just held those stretches on both sides, did an active component. Now your glutes are like, all right, I'm ready for information. What do I need to do? You're most likely going to have a better time doing things like deadlifts, hip thrusts, squats, whatever it is. The other thing I wanted to show, because that kind of just threw me for a loop, go into a quadruped position, and perfect. So what I always see, move forward a little bit. When you see all the females on Instagram working their glutes, a lot of times they end up using lumbar spine and not actually utilizing hip extension for their glute. So what I want you to do is take your right leg out straight but the toes on the ground.
Like this?
Yeah, and you're just gonna like do one of those leg lift things that you see on Instagram. Keep going. So Angel's doing a really good job of actually just utilizing hip extension. Now like overly exaggerate what you see on. So that's what usually happens. So like the leg doesn't need to go that high, and relax. So, but have the leg straight out again. Essentially, I'm going to take you through extension. So essentially like 20 degrees of hip extension is like, that's all it is. But then anything further, it's lumbar extension. Now imagine when you see people in the gym or even yourself going through like, I want to gain more size or aesthetically change my glutes, so I'm going to end up doing those hip extension exercises, and every single time I extend my leg, I'm going into lumbar extension. You know, you may actually have the mobility requirements to actively lift your leg into hip extension, but you think that more is better, so I'm going to create this almost like movement behavior of every time I tell my hip to extend, I'm going to use my lumbar spine every single time instead. And then every single exercise or form of exercise like running, your leg that's supposed to just go to hip extension is now just doing lumbar extension over and over and over again. So you're actually giving yourself a disservice because now you're not actually activating your glutes as much as you should. The other thing that I find is when people do exercises like the glute bridge, a lot of times people will feel, again, hamstring or low back and never glutes. There's a lot of little things that you can do to change that. So let's get into a supine position, legs bent, like we're about to do a glute bridge, because we're gonna go over how I coach the glute bridge. So just do like a standard glute bridge. Just arms out to the side. She's trained to just do it the way I do it. So let's do a couple more. That's essentially what most people do for a glute bridge, and good. How I coach it. So I want to think that if I'm going to utilize an exercise like the deadlift, I want to think of every single muscle that's involved with the deadlift. Because when I look at a warm-up, I want to create a warm-up that is specific to what I'm about to do to get most bang for my buck when it comes to exercise selection. So with the deadlift in mind, a glute bridge is primarily just working hip extension and just glutes, but let's make it a little bit more specific to the deadlift. So the biggest thing that I see that people kind of leave on the table is not utilizing their lats in a glute bridge. And when you look at the lats, they have a huge influence on how your hip structure comes together in any kind of active component. And if you look at how it literally like flows into the glute complex, if you've done your cadaver lab, which she has done just recently, you'll see that like all the fascial lines of the lats like literally dig into your pelvis where your glutes are. So when people say in their like deadlift cueing, like engage the lats, like you want to like think of bending the bar, like all those things. So it's like, okay, well, why don't I add that to my glute bridge to ensure that my low back is not turning on every single time I do a glute bridge. So what I do is I'll get Angel to drive her elbows into the ground. And again, when it comes to like joint centration, we use a fist to squeeze tight, just like if we're squeezing tight on a barbell, to think of bending it in half. So now we have more tension being sent through the lats to kind of communicate with the glutes to go into extension. So let's do a couple of those. Yeah, and good. Little simple thing. Now the other thing too is like when I think of glute function, we also have to think of like the outside stuff of our glutes, like your glute med and min and all those deep six muscles that allow you to externally rotate the hip. So when you do that in a deadlift, because a lot of people don't think of like pushing their hips out this way to make sure you go straight, because a lot of times when people don't engage properly in the deadlift, they'll kind of come up and like swivel to one side, whoever is stronger. So if we think of actively driving our knees out to the side to engage lateral stabilizers, it's going to make things so much easier. So what I like to do is even with the feet, we're going to have them out. Ooh, nice ankles. Feet out to externally rotate. So inside joke. you're gonna drive the knees out to the side into abduction to get more of those lateral stabilizers in conjunction with everything that we just did with the elbows and fists. So then come up, and she's thinking of pushing out, yep, and then holding and then coming back down. So now we have a lot of components that relate to the deadlift that we're making sure that the glutes are actually engaged, the lumbar spine's not involved, and then we're gonna throw a third or fourth thing. I'm like totally four or even five because I didn't even think about the feet, is the breath. So a lot of times people don't utilize their diaphragm, and I've done like 3 episodes on the diaphragm, so go find those. During exercise, they don't utilize the diaphragm properly. So even in the glute bridge, I want to prime my diaphragm to be ready for, say, something like a deadlift or a hip thrust or a back squat. So before every single glute bridge, what we're going to do is take a deep belly breath in to engage diaphragm, and then we're going to go up into and exhale as we do it. Here we go. And then, yeah.
Sorry, did I do it right?
You did. You just held at the deep breath, and it was all good. But essentially what you want to do is like deep belly breath in, you hold it to create a little bit of intra-abdominal pressure, you drive up, exhale, and then back down. Relax. That feel good?
Mm-hmm.
That's a lot. Yeah, stronger. So like a lot of times, you know, you can come up from there if you don't feel good. People exercise or move their body while exercising without any kind of purpose, and it ends up kind of just going through the motions, and that's where a lot of people lose their opportunity to actually utilize what muscles are supposed to happen. So in this case with like hip extension, how many times have you gone to the gym or seen other people do glute bridges just back and forth, and like, are you really getting the benefit, or are you just moving for the sake of moving, right? So you want every single exercise you do have a purpose behind it, have a full intention behind it, so then you can get the most, like, you know, the biggest dividends from your workout. And that's where I think a lot of people kind of miss the boat. Just checking the time. But yeah, like, I think the biggest thing is most people have bad movement behaviors when it comes to hip extension, and then they don't, you know, follow a specific protocol in their warm-up to, you know, improve activation of all their hip extension muscles. And small little changes on something like the glute bridge that go a long way will help quite a bit, because we live in an environment that doesn't, you know, promote a lot of posterior stuff, because we tend to fall into this position a lot. So something as simple as that glute bridge that we all change with all those little things are all the stuff that we need in order to move like a human being that's not being challenged quite a bit. So even from a training standpoint, is like anything posteriorly is going to give us so much more than focusing on just doing bench press and bicep curls and step ups. Like, we want to use this back stuff as much as possible. I think I'm going to leave it there because we kind of started without any kind of rambling, got right into it, and we're already past 20 minutes. So that's it for this episode. Hopefully you enjoyed it. Hopefully you enjoyed our guest, future Dr. Angel Santos, which is going to be amazing, about hip extension and low back pain. If you have any questions, feel free to reach out. Hit the show notes, add me on Facebook and Instagram, subscribe to my YouTube channel, give me a 5-star review on any platform that you listen to my podcast. And if you haven't done so already, watch this video if you've been listening, so you have a better visual understanding what we did here on the floor. And that is it for us. Until next time, you guys, see ya!